everybody, and this is Fray from Motherwise, and we're doing another episode today, and this webinar or podcast, depending on whether you're watching or listening, is particularly talking about when you get to over 40 weeks and what can you kind of expect to occur over that next couple of weeks. Bearing in mind that the absolutely normal period of time to have a baby fully term is anywhere from 37 to 42 weeks. So before 37 weeks is premature labour, giving birth to a preterm baby, or after 42 weeks is when you are actually post-dates. But let's be honest, as soon as we all, when we're pregnant, get to that magical 40-week estimated gestation that is called an estimated due date, suddenly we feel like we're overcooked and the baby is overdue and the whole thing's taking too long. But of course, it's actually not. So the average first baby I have read research on is born at 40 weeks and 10 days. I don't know how accurate that is, but anyway, so it's very, very normal to give birth between 40 and 42 weeks, especially with the first, I think. And to be honest, look, those babies that are just that little bit older can do so much better afterwards. They're just a lot more robust. A 41-weeker is a lot easier to breastfeed in general terms than, say, a 37-weeker who's 4 weeks younger. So that's a good thing. But also, so what kind of is a normal process? Now, obviously, every different hospital and country and region and doctors can have different policies. But to give you a real rough kind of overview, so certainly, once you get to 40 weeks, it's certainly giving you permission to be pretty proactive on trying to get your body into spontaneous labor, because it is great if you can absolutely avoid an induction of labor purely because you are post dates. And if you are post dates, I cannot at all in good conscience say that it's a good thing to be getting to be voluntarily agreeing to an induction before you're at least sort of 41 weeks and 5 days, or 41 weeks and 6 days, or 42 weeks. If the only reason for that induction is because you're post dates, because you are not post-dates until you're 42 weeks. And it is far safer for you and far safer for your baby for you to go into spontaneous labor rather than being induced before your cervix and your baby and your body is ready. Yet that takes you from a low risk to a high risk labor. With substantially increased statistics of complications of instrumental deliveries, emergency deliveries, traumatic deliveries, cesarean deliveries, lower ABGAR scores, higher hemorrhage rates, etc., etc. So, yeah. Anyway, so in general terms, once you get to 40 weeks, and especially by 41 weeks, if your midwife or obstetrician is suggesting that they do a stretch and sweep of your cervix, which is an internal exam where they stretch your cervix open a little bit and sweep the membranes that are connected to it, that's a I'm kind of pro that, to be honest. If it's do a stretch and sweep and help the woman go into labour, or not do that intervention and then she needs an induction, well, that's a no-brainer. That is interfering. It is an intervention, but it's a very mild one. And let's just say that midwives have been doing that intervention for thousands and thousands of years. Obstetricians did not invent that. Okay, so stretch and sweeps, and just knowing that your baby's got good fetal movements. That usually at around 41 weeks, it's pretty normal to have a post-dates ultrasound, and there's a few different checks that they do there, but particularly making sure everything, placenta looks good, waters around the baby looks good, etc. Then usually beyond that, you would have every 2 or 3 days a CTG. So that's the belts that go around the tummy and do a little printout and check baby's heart. So that's really, apart from that, it's just kind of a sit and wait. But look, I do go into a lot more detail about this on my full-length webinars and podcasts. So we'll add the link on there to the bottom of this, wherever you're looking or listening to it, so you can see how to connect in with that if you'd like to join our Essential Basics program. Okay, I wish you all a wonderful week, and just remember, this baby's going to be born exactly on his or her perfect date, because I believe these babies choose their birth date way in advance. Okay, bye everybody.